Hi, I'm Amelia Johns with the Clark County Health Department, a public health nurse, and we are here today at the Clark County Interchange. Basically, I'll kind of give you guys a rundown of what it's like when members come to the interchange and what we do to help them and everything. So when they come in, basically, if they're new, then we take basic information from them. It's not much. We're not allowed to get ID. We get initials, and we get their month that they were born and the decade they were born and a zip code, and we issue them a card by that, and we kind of bring them in to the program, and we usually go into one of the rooms here, and it's all private, it's all confidential. They just basically try to make them feel comfortable and build a relationship with them so they feel at ease to come back. So when they come in, if they have needles to bring back to us, then they can put them here. We are able to tell basically how many needles they do bring back by the way that it's filled. Typically one of our boxes hold about 50 needles, and if it's full, then we know that there's about 50 in there. If it's less, then we can kind of tell by weight like how many's in there. So we have a lot of different information that we can give to the members. We have information about syringe changes. We have information about harm reduction. We have information on how to inject correctly. We have information on HIV, Hep C, and the testing that we provide here free to them. We also provide Narcan for them. They do have to take a training and a little class on that, and we kind of educate them about the Narcan and how to give it correctly. And we also provide them with referrals to treatment for detox. We also provide them with any type of information that they may need for housing, clothing, if they need assistance with meals, insurance. We usually have a navigator here that can help them get set up with insurance. We opened our program January the 26th of 2017. Since then we have had 184 members that have came to be seen here. About 80 of those come back, not really monthly, but we have a couple that come every week. So most of the time it's sporadically. They don't get to make it every single week, but they usually are pretty good about bringing their needles back to us. It is an exchange, so if they have 100 needles and they bring 100 needles back, then we give them 100 that they need again. If they don't bring their needles back, then we start them back off with 10, and we go from there.